Good afternoon on this very beautiful spring day. It's a lot like it wasn't a week ago. On behalf of the entire School of Public Health community, I want to welcome you all to this amazing event. Made amazing because you're here in the audience, and that deserves the first round of applause tonight. So I assume you know I'm John Finnegan. I'm the Dean of the School of Public Health, but if you don't know that, I'm John Finnegan. I'm Dean of the School of Public Health. In communication, we like to repeat things, and pretty much you learn those things when you hear the message over and over. So I am grateful that you have all chosen to join us on this afternoon to celebrate our 2018 Alumni Award winners and the public launch of a fundraising campaign that is going to allow us to boldly shape a future of health. This is a great day in the history of the school. We come together to share with you our vision for the future and to recognize and thank you, our alumni, our benefactors, our public health friends and allies for the many ways that all of you have partnered with us. Like the school, you too are driven. This is a theme you're going to hear me repeat over the evening. And in fact, for the next 2 years at least. So get used to it. You are driven to save lives. You are driven to prevent disease. You're driven to shape a future of health. And anything that we accomplish at this school, we will do in partnership with you. So we want to thank you for joining us and for celebrating with us tonight. It is now my great pleasure to welcome our Master of Ceremonies for the evening, Aimee Cambronero. Aimee received her Master of Public Health degree from our Maternal and Child Health program in 2009. That was the first program of its kind in the nation. And her talents are many. Among them is her work designing and implementing and evaluating public health development programs in both domestic and international settings. She is today the Director of Impact, Analysis, Evaluation, and Learning at the Minneapolis Foundation. And she helps the foundation define better its impact in the community. She helps to set up systems and processes to help measure it, and she uses data to tell the story of the foundation's impact. She is also our current president of the SPH Alumni Society Board, and she serves on the campaign cabinet for the School of Public Health's Driven campaign. There's that word again. Ladies and gentlemen, please welcome your MC for the evening, Aimee Cambronero.
Thank you, Dean Finnegan. Sorry, I have to move the microphone down a little. And good evening, everyone. It's great to see you. Imagine with me for a moment. Imagine a world where every person, every community has the opportunity for a healthy life. During my time as a student, I learned that public health is about prevention, stopping suffering before it starts. I learned that public health is about people, identifying innovations and solutions, not only for one individual, but for entire populations and communities. Finally, I learned that public health is about partnership. Academic research can't affect change in a vacuum. It must be enacted through partners and community. As a public health professional, philanthropist, a community partner, and a community member, I know we need this school. My education at the school, as well as the enduring relationships that I have with SPH faculty, staff, students, and alumni, help me serve the people of Minneapolis through my work. As president of the Alumni Board, I am proud of the history of the pioneering research, innovative education, and collaborative partnerships that have continued to position us among the top 10 schools of public health. Tonight's program will explore the many ways that the school has made an impact, where we're working relentlessly to improve public health, and the vision we share with you for a future of health. Now, we can't tell the story of the school without telling the story of our alumni. The 11,000 alumni that this school has trained are informing new policy, running healthcare systems, ensuring pharmaceuticals are safe and effective. They are helping us respond to a changing climate, limiting the spread of infectious disease, shaping interventions for people at risk of mental health challenges. Amongst these legions of public health advocates are a small group of alumni and friends who represent the tenacity, collaboration, vision, and creativity that are hallmark of our school. Earlier this evening, we took time to honor 5 individuals who have accomplished amazing things in public health. The 2018 Alumni Awardees hail from across the U.S. and were nominated and selected by a committee of their peers as exemplars of the commitment, bold vision, and fortitude that we need in public health. I am so proud to call these individuals fellow alumni and friends.
When I saw the list of Gaylord Anderson Award winners, many of whose names I recognize, of course, I was totally humbled that I would be considered in those ranks. I hope that I've had tremendous impact on improving the patient experience. I worked hand in hand in the design and delivery of the new Dana-Farber Cancer Institute at Harvard, and I've worked hard to improve the patient experience through the engagement of patients and families in the care and delivery process. My greatest impact, I think, is through the students I've taught. I've taught now for 40 years at 8 different universities and done hundreds of speeches. And a student of mine gave me a cross stitch that said, "Teachers create the future." And I think we do.
I've been very, very fortunate and have the opportunity to be with a number of organizations that were interested in work overseas as well as the U.S. I was the head of research and development for the Pathfinder Foundation and came up with the innovation of having a pelvic model, which has saved literally thousands of lives over these years, that one could use with untrained women that would mimic the human pelvis, and they could insert an IUD without puncturing through the human body, which is what they were doing, and we're having so many deaths due to the puncture rather than the intrauterine device.
I'd like to think that I've changed the field of public health in a couple of ways. First, I hope that by the technical assistance that I'm providing and some of the guidelines that I've written, that people are able to provide really evidence-based public health program. I'd also like to hope that with the clinical training that I've provided to public health practitioners as well as clinicians, that people are delivering more compassionate and more evidence-based care to their patients. I'm currently doing a fellowship on public engagement, so I'm learning skills about how to message the public, how to communicate with the public, and my hopes are to increase the national conversation around sexually transmitted diseases and hopefully reduce stigma around that topic. Encourage people to go out and get tested, and also not to feel ashamed to do that, and to take charge of their sexual health and be positive about it.
What I have gained from mentoring is, first of all, a lot of hope. And I've met so many great young people who are already kind of changing public health that I've gotten to know. And I see the importance of having the next generation of public health students become the leaders of the future. That is a real strength of this school. And I've actually known students, one this year told me they came here, one of the big reasons was because of the mentor program.
I think the School of Public Health has taught me about the value of connections, the value of collaboration. And so it's resulted in a career where I get to do a lot of advocacy work. I get to do some clinical work, which I love, and I get to think a lot about systems and how do we really tackle an enormous problem on a national level, on a state level, on a local level, so that we can help people to have more fulfilling lives and we can save lives. I think the 2 things that I'm proudest of, in 2016 I helped pass a bill. It was the first bill that was ever passed on the federal level that contained eating disorders language. and has provisions that will help people with eating disorders. I'm really proud of that. I actually wrote some of the words that are in the bill, and that was passed and signed into law by President Obama in 2016. And it's tied to the second one. The second one is that I think that in some small way, hopefully in a bigger way, I'm helping save people's lives.
This award is really humbling, but I think a lot of it has to do with the fact that I had these great mentors when I was at University of Minnesota. I mean, they just gave me the confidence to be able to be up front and to lead, and to be acknowledged for that is just really exciting. Makes me feel like I'm doing something right.
That's really my goal in life, is to make a difference. So getting this award tells me maybe I am.
I really, really treasure that we've had the opportunity, my husband and I, to do our little part in public health. I think it's been a great joy to me to have had the chance at the University of Minnesota to take those first steps.
You can't imagine the breadth of opportunities in public health and what will come your way if you are diligent, earnest, and put your heart and soul into what you do.
We would like to recognize each of the awardees. Award recipients, as I call your name, would you please stand so we can honor and congratulate you? The Gaylord Anderson Leadership Award is given to an individual who embodies the former dean's qualities as a visionary leader, teacher, collaborator, and public health ambassador. Our 2018 Gaylord Anderson Award winner is Dr. Janet Porter. The Alumni Award of Merit recognizes alumni who have achieved professional excellence in the field of public health and contributed substantially to the health and well-being of people, communities, and society. This year's Alumni Award of Merit is awarded to Dr. Jillian Kroll-Lampert. The Alumni Innovator Award is given to an individual who has made, developed, or implemented innovative ideas, approaches, or solutions to public health. This year's award winner, Dr. Jean E. Moorhead, is unfortunately unable to join us this evening, but please give her a round of applause. The Emerging Leader Award is presented to a graduate of the school who has made significant impact in the profession within 10 years of graduation. This year's award goes to Dr. Ina Park. And finally, our Outstanding Mentor Award recognizes a dedicated mentor who has made outstanding contributions to the career and professional development of SPH students. This year's Outstanding Mentor is Gary Greenfield. To all of our awardees, a heartfelt congratulations, and I would like to invite Dean Finnegan back to the podium.
Award winners, it's hard for me to top your remarks about what this School of Public Health and this University of Minnesota has done for you. So I want to second Imy's congratulations, and I want to thank you for the many ways that you embody the values of our great school. Our community of alumni, friends, faculty, staff, and students, we act in partnership to accomplish much more than any one of us could possibly do alone. And by working together, we create a lasting influence that is much greater than the sum of its parts. Next year, 2019, will be the school's 75th birthday. We were part of the second wave in the World War II era that saw the establishment of independent schools of public health in public universities, and especially land grants like the University of Minnesota. And yet, the University of Minnesota was the first in the nation to appoint a professor of public health. And the president of the university, Dr. Falwell, did that in 1874. That was before I was born. That's only, 144 years ago. Amazing. Minnesota was a first. And during all this time, Minnesota has been at the forefront of public health research and health system research and education. We are driven to discover because that is the land-grant mission of this university, and its DNA is in our field of public health. Public health in Minnesota was made solid by all the giants that have preceded us. They were the pioneers. They pushed into the new territory with seminal works that have become the pillars that keep our schools strong even today. Today's experts draw on that wide breadth of knowledge to shape their work, to build on it. And their ability to innovate and adapt continues to position our school among a select few that are relied upon, expected to help solve the world's biggest health problems. We are known around the globe for our work in understanding and preventing heart disease, cancer, and chronic diseases of lifestyle, including the social determinants of health, such as social and racial inequities. We are known for our research in the causes and prevention of obesity, preventing and preparing for infectious disease outbreaks, keeping workers safe from injury and illness, and developing leaders of vision who will lead healthcare and public health systems well into the future beyond our own time. It is every morning a great privilege for me to get to work and be the dean of the School of Public Health. And I think that's also true for our faculty to get to work and to do the fabulous teaching and the research that they do. We all take very seriously our responsibility to maintain the school's excellence so that we can advance the work that we do. And I know that the school is well positioned for this task. Tonight, we are introducing our Driven campaign. There's that word again. And that word, for the next 4 years, is going to help us shape critical areas to meet the needs of a changing world when it comes to health and public health. We live in a time of extraordinary change. I think everybody who's ever lived on this planet lived in a time of extraordinary change, and we are no exception. There is rapid population growth today, unprecedented aging of societies, a hyper-connected global economy, and a warming climate. A sense of urgency pushes us to tackle these challenges, and now is the time to support this work. As we take on these grand challenges, we know that partnerships are central to everything that we do. Our work with the Minnesota Department of Health, the Mayo, Minnesota hospitals, nonprofits, and Fortune 500 companies like 3M and Medtronic, nonprofits, all of the people that represent these organizations are with us here this evening. They put our school at the nexus of big, big questions that need big imaginations and big solutions. Conducting research with our partners gives our work depth and relevance. These relationships also enhance our classrooms, ensuring that our curriculum is in step with the current needs and looking over the horizon in the anticipation of change. Close ties with NGOs and schools in global settings, such as we are associated with in India, Thailand, Uganda, Vietnam, and more countries, provide us with opportunities for our students to work on field experiences abroad, from remote villages to urban clinics to the headquarters of the World Health Organization itself, and here at home. These experiences widen the aperture of how students view the world and how they will enhance and impact the world they will create as our alums. Our school's educational offerings have changed public health in some very significant ways. We created the first Master of Healthcare Administration program. We created the first Epidemiology PhD program, the first Maternal and Child Health MPH program, and most recently, we're not done yet, the first Sexual Health minor. Achieving health for all requires bold thinkers and bold doers. At our school, we believe that bigger imaginations will yield bigger results, and we put that thinking into action through our research and translate it in our education and practice experiences. Currently, we are exploring new insights that push toward a world where all people will have access to fresh and healthy foods, where mothers and babies have equal treatment during childbirth, regardless of where they live and the color of their skin, where our environment is free of harmful toxins, and where people receive the right vaccinations to prevent damaging and deadly diseases. If this is a short list of our current work, what does the future hold? How will we at this SPH shape the future of health? Right now, you are witnessing a transformational moment in the school's history. Our Driven campaign aims to raise $40 million by 2021. That is an unprecedented philanthropic goal for this school. In 75 years, we have never tried anything like this. And I have every confidence, because you're here, and there are so many others that would like to be here, I have total confidence that we will get there. Because when people give to our school, they share with us a fundamental belief that health is a human right. They're saying, we are joining the legions of advocates, alumni, faculty, and friends who are driven to save lives in Minnesota and around the world. We are driven to shape a future of health for all people. Thank you all so very much for being here. Yes, I have a postscript note. In all of its history, our School of Public Health has been scattered hither and yon around this campus. I work in yon. The people in the West Bank work in hither. Or maybe it's the other way around, I'm not sure. That hither and yon has not prevented us from doing astonishing work. And while our campaign is not about bricks and mortar, I want to share with you that there is a project underway that may well bring together the SPH for the first time in its 75 years. Now, mind you, this is not a done deal, so please don't trumpet it too loudly, but it has promise for us, big promise. The university and United Properties are negotiating a joint venture that would build a complex of hotel, condos, and retail space on University Avenue, just down the block there by the stadium. And it will likely include a major center for innovation in university and private sector relationships and projects. This is a center that could very well bring the entire school together under one roof with lots of room for corporate and NGO joint projects with us and possibly other university colleges. As this develops, you can bet your boots I will keep you apprised. But if you are as excited about the possibilities of this joint venture project as I am, and I think most of my faculty and staff and students would definitely agree. A note to President Gaylord or Senior Vice President Brian Burnett, or even to Santa Claus, would be very, very well timed. And ladies and gentlemen, the possibilities are amazing when we are driven. Thank you very much.
Well, I remember going from hither to yon as a student, and I am very excited about that opportunity. Well, tonight we'll hear from two individuals who represent what investment in shaping a future of health campaign looks like. Audrey Workman is currently a student in the Master of Healthcare Administration program. She's benefited from philanthropic investment at the school, and after you'll hear from her tonight, I'm sure you'll understand why we are thrilled that she chose the University of Minnesota for her graduate studies. Please welcome Audrey to the stage.
Thank you, Amy. Well, it's a pleasure to be here this evening with all of you who made my public health education possible. Though new to the school this year and new to Minnesota, it's incredible how quickly I've come to feel at home here. Here, I found a community that shares my values of health as a human right, of collaboration and teamwork, to better lives of individuals and families, and of shaping a better future for all. I've always had an intrinsic desire to help others. Early in my youth, I was drawn to healthcare as an avenue to directly improve the quality of life of my friends, neighbors, and community. I started my undergraduate studies in pursuit of a career in medicine, with no idea to the extent that health and healthcare would quickly become a major part of my life. In my last year of school, while serving a church mission in the Philippines, I had my first personal experience in healthcare when I got a mosquito-borne virus that left me hospitalized in a rural Filipino hospital. Beyond the rice and fish heads that were served for breakfast, lunch, and dinner, the experience opened my eyes to the great need for quality improvements in existing health systems. And that experience was just the beginning. 3 months after I returned home from my 18-month mission in the Philippines, my fiancé Jared and I were to be married. However, just 6 days before our wedding, my fiancé Jared was in a horseback riding accident that left him comatose. Instead of newlywed bliss or normal concerns of school and internships, I spent the next 5 months at his side in a hospital. For the year after that, we were in a long-term care facility. Since then, not only were we married, but we've transitioned home and to home health and outpatient care and a variety of community programs. Those experiences ingrained a drive in me to advocate for patients, to build strong health systems, and improve health in our communities. I have a vision and passion for truly patient-centered care. And being here at the University of Minnesota School of Public Health positions me to make my vision a reality. I'm receiving the education and training that will allow me to go out into the world and make a difference. But I wouldn't have been able to come here had it not been for the scholarship support that I received from alumni and friends of the School of Public Health. Thank you for helping me get here, and thank you for joining us in this historic campaign. Your support, mentorship, generosity, and shared values and shared vision enables me and others like me to build on our experiences to shape a better, healthier future. Thank you.
Thank you, Audrey. You give us confidence in a future of health. Our school has been a leader in aging research for nearly 75 years, and we are forging solutions today to meet the future needs of tomorrow. In the US, 10,000 baby boomers a day are turning 65. This unprecedented ballooning of the aging population will increase the number of people requiring nursing homes from 1.3 million in 2010 to 2.3 million in 2030. By 2050, 20% of the world's people will be over the age of 60. Our next speaker brings novel, creative, problem-solving approaches to challenges accompanying this rise in the aging population, like compounding disease and the needs of a more culturally diverse population. Dr. Tatiana Shippey is an associate professor in the Division of Health Policy and Management. She is a social gerontologist with a focus on what really matters to people as they age, such as quality of life in long-term care settings and the role of racial, ethnic, and socioeconomic disparities for older adults' quality of life. Welcome, Dr. Shippey.
Thank you so much, and what an inspiring story by Audrey. I had the opportunity to serve on her fellowship committee, and I can speak to the rigor of her work. And I am just so proud to be a faculty member in this great school, and such an honor to be with all of you here today. Well, my own academic work in aging has had somewhat of a circuitous path. I'm originally from Ukraine, and came to the United States as a law student, thinking I would brush up on my language skills and go back home, right? But I fell in love with the US, and I really appreciated all of the educational opportunities and the freedoms we have here. So I decided that I would pursue an undergraduate degree in sociology. Well, little did I know where that path would take me. In my sociology classes, I was shocked to learn about various disparities. My senior paper focused on excess mortality in Russia and Ukraine due to alcoholism, an issue that I personally witnessed multiple times, but never heard discussed on a system level back home. I also heard and learned about various racial disparities in health outcomes, and witnessed my Black friends being denied leases in certain parts of the city where we lived. And that is when my commitment to do something about these disparities was born. At about that same time, I took a course on aging and felt a call to work with older adults. I ended up living with an elderly couple where the husband was a retired professor who was taking care of his wife with dementia at home. And I was just so inspired by his commitment to provide the best care for his wife possible, despite the fact that he had health troubles himself. He actually suffered a stroke before that. And so, from these two seemingly disparate paths, my area of research was born, addressing disparities and care for the elderly. I applied and was admitted to a unique PhD program, a program that allowed me to pursue a dual PhD in gerontology and sociology. As a part of this program, I was the first student who was selected to live in a retirement home. I lived there for 2 years to try and understand what is it like to age from the experiences of residents themselves. This program is now nationally recognized and also created the foundation for my current research. It was during those 2 years living in a facility that my husband and I had our first dates. You see, he was, right? He was a PhD student in the program as well, and I could tell that I made the right choice when he was approved by about 100 grandmas who lived in the facility and who all adopted me. And you know, I witnessed so much generosity and support from the residents who threw wedding showers for me in different floors of the building, and who also spent 2 days on a bus driving to Minnesota, and the bus being driven by the administrator of the facility. And so from these experiences and from the relationships that I built with the residents, I saw that how important it is to focus not just on quality of care, but quality of life for the residents who want to be seen as people and not patients. When I was in the job market, I wasn't sure of the department that I wanted to join, but I knew that I wanted to be in a place that valued action. I didn't want to just teach about inequality, I wanted to do something about it. And so that is how I ended up at the School of Public Health. My decision was a good one. During my time here, I've been able to build relationships with the Department of Human Services and other agencies that work to improve care for older adults. This work is close to my heart, and there is so much yet to be done. We need to do better by our older adults. Regardless of the setting they live in, the color of their skin, or any other status characteristics, we need to strive to ensure that older adults receive care that maintains their dignity and personhood instead of merely reducing them to their physical and cognitive needs. My current work on disparities in nursing home care shows system-level disparities in quality of life for residents of color. In order to effect change, we need to work with partners, including the state and providers. We need to rethink models of compensation and monitoring for facilities that have high proportions of residents of color, as well as severe mental illness, substance abuse, or any other co-occurring factors. There will be a need for community engagement and volunteerism to help create a culture of care in these facilities. The School of Public Health and my research team has an important role as well. We must ensure that we generate evidence that can be used to inform staff training and prepare future leaders to ensure that residents receive care that is culturally sensitive and that nourishes their quality of life. There is a great need for more evidence and data on assisted living and other forms of long-term services and supports that can be used to drive policy, practice, and ensure quality of life for all. My vision as an academic is to do the work necessary to change the persistent disparities for minority residents and immigrant residents, as well as improve care for all, regardless of the setting that they live in. I have a passion that ensures that I will work tirelessly to bring about needed change in a way that we can shape a future of health for aging adults. But as you know, this is something that I cannot do alone. Our work together is to shape a healthier future for all. So I want to thank everyone here for sharing that vision with me, with the school, and for your ongoing commitment to shaping the future of health. Thank you so much.
Dr. Shippey, thank you. We are so honored to have talented, dynamic faculty like you with the school, and we're truly lucky to have alumni leaders and students who are the face and the future of this work. The stories of the school and community are some of the most powerful tools we have to affect change. As such, I'm proud to share with you our Driven campaign video, which really lifts up the stories and the case for investing in public health. These are just a few of the stories we must continue to tell if we want to grow the commitment to public health. And there's never been a better time to tell this story.
At the University of Minnesota School of Public Health, our desire to create healthier communities throughout the world drives our pioneering research and education.
Our students leave with the ability to lead healthcare organizations, which will impact their communities for decades to come.
Our community of students, professors, and experts take on the world's biggest challenges, battling disease, epidemics, unseen dangers, and inequality.
A lot of diseases and problems that we face in society are complex, and we've known that for a long time, but it's only now that we have the technology that can be used to tackle those problems.
We go upstream to discover the source of a problem, then work with partners to implement lasting solutions. For nearly 3/4 of a century, we've developed the brilliant minds who transform health policy and confront the unacceptable in order to help millions live better lives.
What distinguishes public health researchers is passion and love for what they do.
Here in Minnesota, we're creating breakthroughs that end health disparities at home and around the globe. Join us in our pursuit to shape a future of health. Because health is a human right.
And at this time, I'd like to welcome SPH Alumni Society past president, retired healthcare executive, former Medicaid state director, and SPH campaign cabinet chair, Brian Osberg, to the stage.
Thank you, Amy, for all the work you do to support the School of Public Health. And congratulations to the outstanding Alumni Award winners we are recognizing this evening. You represent the great contribution our school makes to the world of public health. Your accomplishments and inspirational stories we just heard from Audrey and from Dr. Shippey are great examples of what we can do as a school and why our driven campaign is so important. My message is this: we not only have the opportunity to shape a healthier future, we have the obligation to do so. The School of Public Health can and will play a critical role in addressing many challenges affecting the health of our communities, only if it has the necessary resources. As you know, the school's impact is not only at the regional level, but national and global as well. Look at the posters around us today depicting the great work that our school does throughout the world. So, along with my fellow campaign leaders, I have the privilege to publicly announce the launch of a $40 million campaign for the School of Public Health. Now, don't touch the champagne yet. It's coming around. We're going to have a toast here in a few minutes, so otherwise we can fill your glass up later, I suppose, but we're going to have a toast in a minute. The campaign priorities reflect what's important to the school's mission: investment in student success, investment in pioneering research, and investment in a world-class faculty. We are truly driven to make a difference. No doubt this will be a challenge. The last time we had a campaign was 20 years ago, and we fell short. But as they say, if your goal or dream is not scary, it's probably not big enough. This is the largest campaign in the school's history. However, we have already raised $23 million to our $40 million goal. Thanks to a lot of people in this room. Thank you for your contribution. Thank you for your support. And I join Dean Finnegan that I'm very optimistic that we're going to make this happen. We have strong leadership in Dean Finnegan and Senior Associate Dean Beth Vernick, and great staff, dedicated and really professional staff, by Louis Clark and Sarah Bjorkman and others. And we have an excellent cabinet. In the back of your program, you'll see our cabinet members. So I am very optimistic that we're going to make this happen. Because of the education I received here at the School of Public Health, I was given the opportunity to contribute to the essential cause of improving the health status of our citizens, especially the most vulnerable among us. Growing up a poor student, a poor kid in the city of Minneapolis, I had the opportunity to go to any college in the country as long as on the bus line from my home. Well, fortunately, the University of Minnesota was on the bus line from my home. So I had a very rewarding career and a comfortable life. And this is why Jean Marie and I have decided to give back, to supporting the school the best we can. I know many of you feel the same way. We invite you to join this campaign. There's a great deal you can do to support the school in this campaign. Become ambassadors tell your compelling story to your friends and colleagues about the School of Public Health and how it can shape the future of our healthcare system. Become advocates of the school to policymakers. Participate in our activities in our organizations, our MHA Alumni Board, our School of Public Health Alumni Society Board. Get involved in other activities. This fall, we're going to be putting on James A. Hamilton Symposium. It's going to be excellent, and participate in all the great work that the school is doing. And also, of course, consider making a gift, a current gift, or thinking about an estate gift down the road. We can help you make that happen. Go to our website. We have a new website. It's very sexy. Go to it and see what options you may have. And take home the pamphlet. There's a pamphlet at your table. Take that pamphlet home with you and understand what our mission is. No matter what your next step is, please engage in the shaping a future of your health. And we want your advice on this. We have, as I said, a number of years to go for this campaign. So let us know what you think we should be doing. Reach out to one of us in the cabinet, or reach out to the dean, or to Louis Clark or Sarah, and give us your advice as to how best to go about doing this. Finally, I had the distinct honor to introduce John and Nancy Lindahl to lead us in the christening of our campaign. The Lindahls are serving as co-chairs of the $4 billion University of Minnesota-driven campaign. John serves on the U of M Foundation Board of Trustees and Medicine and Health Board of Overseers. Nancy is a Foundation Life Trustee and past president of the University of Minnesota Alumni Association. They are no strangers to campaigns on this campus, having co-chaired the TCF Bank Stadium campaign that brought football back to campus. Their dedication to this university is truly inspiring. Please join me in welcoming John and Nancy Lindahl.
Thank you, Brian, for that gracious introduction. First of all, we are driven. We are maroon and gold driven, I can tell you. I think it's my middle name. I'm so humbled and honored to be here following Audrey and Dr. Shippey's speeches. I'm going off our speech right now. What an honor to follow the two of you and your stories. Your stories are really why the university is driven to succeed, and so proud of both of you. And Dean Finnegan, your history here. We applaud you. John and I are really pleased to have the chance to speak to you tonight. We were at law school on Friday night. We're going to be at vet med soon. I want a degree a night, so I'm going to be in school for a long time. But I am so impressed by the achievements of this school. This evening has reminded us why we agreed to be co-chairs of what's the name of the campaign? Driven campaign. We are only two of a virtual army of over 275 volunteers who have stepped forward to be ambassadors for this campaign. Your personal engagement that Brian just talked about and support are so important to helping to make an even bigger impact. Thank you for all you've done and continue to do to make a difference on this campus and obviously across the nation and around the world. The university's reach is felt everywhere, and tonight is your chance to be driven to catch part of that momentum.
Well, good evening. Nance and I met on campus in the 60s.
We're
that was
old.
a while ago.
We're old.
And built a foundation of our careers here, just like many of you. We never imagined that one day we would lead the largest campaign in the University of Minnesota's history. As we've seen tonight, you don't have to be an alum to appreciate the importance of our School of Public Health. whether it's a student like Audrey, whose personal experience inspires them to become a healthcare leader, or the talented researcher like Dr. Shiffey, who is working to improve the quality of life for our aging population.
That would be us. Thank you.
There is so much happening that gives us great hope. People everywhere seek out the School of Public Health expertise every day, and we all benefit from a strong university.
John and I are so proud of the impact of Minnesota's flagship institution. We're really proud to be grads of this great place, like all of you. And we take great joy in investing our own time and resources. John calls himself the great pass-through, because the second he makes it, he kind of sniffs it and I give it away, and it all ends up here. So that's my part of this too. Already more than 200,000 generous people have joined us in supporting the university with the Driven campaign. I kind of think you can go above 40 million. I have good feelings here tonight. Each of you can help the university and the School of Public Health do more, aim higher, and build a better future. As you heard tonight, we invite you to ask that same question. What drives you? Is it healthier aging? Is it health equity? Is it stopping the spread of disease before it starts? Are you driven to support students, faculty, and pioneering research? Or are you energized by the partnerships and collaboration taking place with the wider community? No matter what drives you, part of Driven, we're confident that the campaign can help make it all possible. Your investment in the School of Public Health will help lead the way to building a future of health. John and I want you to, we're standing between you and your glass of champagne, so I'm going to grab ours just a sec.
Now, this is the part you have to follow directions.
You have to listen carefully, so don't drink yet.
Now we invite you to stand, but we're going to do this sequentially.
Wait.
As your connection to the school is named, lift your glasses and join us to a toast to the future. First, to Dean Finnegan.
Yeah.
Our talented faculty leaders.
Faculty up. Good. Stay up.
Our campaign volunteers and donors. Then to our amazing students, alumni, and community partners.
You're all on your feet by now.
Let us toast to shaping a healthier future together. Cheers.
Cheers. Thank you.
Thank you, John and Nancy. And as our program concludes, I encourage you all to stay for the reception and also take a look at all of the great work that's being done and presented around the room. Help yourself to dinner and drinks in the back of the room, and please enjoy getting to know each other. Thank you again for joining us as we shape a future of health. Thank you.